Hi, I'm Emma Dunstan. I'm from the Asthma Foundation, and I'm here today to talk to you about asthma in adults and asthma in seniors. The reason that we're here today having this chat is because asthma is a very serious condition. In Australia, we know that there are 2 million people with doctor-diagnosed asthma, so we do assume, particularly in the seniors, that there are people out there that haven't had their asthma diagnosed. We also know, unfortunately, that there are 400 deaths due to asthma every year, of which half of those are preventable. Asthma is a condition of the airways. So people with asthma have got sensitive airways. So their airways respond differently to people without asthma. What happens is that the airways become blocked, the muscles around the airway tighten, the lining of the airway becomes inflamed. And with that inflammation, there's extra mucus that's being produced, which causes the airway to become blocked on the inside. The most common triggers that we see are colds and flus. So when people get a virus or a cold, trigger off their asthma. Exercise is also a very common one. We know a lot of people have got what we call exercise-induced asthma. Medications, which is particularly important when we're talking with adults and with seniors because of the range of medications that people can be on. It's important that if they do have asthma, they inform their GP as well as their pharmacist. And then we've got different things that are more allergen type driven, so pollens, dust, mould, hair and dander from animals, perfumes, anything that's really strong smelling chemically. There are 4 main symptoms of asthma that we know result from the tightening and the constriction of the airways. They're the sort of dry, irritating, persistent cough. That's more so present morning and night when the air's cold. Wheeze, so whistling sound in someone's breath, tightness of chest, as well as shortness or difficulty breathing. So they've noticed a change in the way that they're breathing and their ability to breathe. They're the 4 main things that we'll see. I guess the most important thing if someone does experience 1 or 4 of those symptoms is to not ignore them. A lot of people think breathing difficulties is just a normal part of getting older, but generally there's a reason behind those. So it's really important if you did notice that you were having those symptoms and they were perhaps persisting over a number of days or a week to follow up with your doctor to get things checked.